So in hip joint, we had the formula 1 plus 3 plus 3. In knee joint, our formula is 1 plus 2 capsular thickness. So 1 is capsule. I'm going to come to this, don't start writing. The plus 2 collateral ligaments will be there. We have to study radial collateral, ulnar collateral. So tibial collateral. There will be 2 menisci. There are 2 menisci. Okay? And then there are 2 cruciate ligaments. Anterior cruciate and posterior cruciate. And 2 popliteal ligaments, oblique popliteal and arcuate popliteal. So 1, this, and 10 ligaments. Total 11 ligaments. Total 11 ligaments. But if you know the formula, मैं तो आप 11 बाहर कर 11 कैसे मैं तो 4 ही याद आ रहा है 5 ही याद आ रहा है 1 is 2 thickness of the capsule, 2 collateral ligaments, 2 menisci, 2 cruciates and 2 popliteal ligament, oblique popliteal, arcuate popliteal. So let's start. Knee joint type. You say it's a modified hinge joint. You pass. Pass. Modified hinge joint. Pass होने के लिए क्या बोलेगा?
Modified hinge joint.
Modified hinge joint of synovial. अच्छे मार्क्स चाहिए तो क्या बोलने का? It's a modified hinge joint of synovial variety, which is a combination of 2 joints. A condylar joint between femur and tibia, and a saddle joint between femur and patella. That completes the description. Okay. So it's a modified hinge joint of synovial variety, which is a combination. It's a modified compound. More than 2 bones are there. It's a modified compound complex joint of synovial variety. Modified hinge compound complex because presence of menisci. Whenever there is menisci, articular disc joint becomes. So it's a compound complex modified hinge joint of synovial variety. Compound complex modified hinge joint of synovial variety, which is a combination of 2 joints. Condylar joint between femur and tibia, and a saddle joint between femur and
patella.
Is that clear to all of you? After type, what we write? Articulating surfaces. So here, बाकी सब जगह हम लोग articulating surfaces लिखते थे 2. Superiorly, inferiorly. Or shoulder joint we used to write medially and laterally. Elbow joint we wrote superiorly and inferiorly. Here, what will you write? Here you will be writing superiorly, inferiorly, and anteriorly. 3 आएंगे यहाँ पे. Superiorly, the lower surface of the femoral condyles. Inferiorly, upper surface of tibial condyles. And anteriorly, posterior surface of patella. Posterior surface of patella. Clear? Superiorly, inferiorly, anteriorly. Anteriorly क्या है? Posterior surface of patella. Capsule. In any hinge joint, capsule is strengthened by collateral ligaments. It is weak anteriorly and posteriorly. Any hinge joint. Capsule is weak anteriorly and posteriorly. एक हो गया वो. Then capsule का attachment along the margins of the femoral condyles, lower down along the margins of the tibial condyles, That will be the attachment of the capsule. So capsule we write the attachment पहले ऐसा है along the margins of the femoral condyles and tibial condyles. Then we write to write opening है क्या कोई opening yes. There is a opening for tendon of popliteus muscle. Opening for tendon of popliteus muscle. Opening for the tendon of popliteus muscle. And again there is a communication with one bursa also. Most of the joint have communication with bursa. That communication can be dangerous because if that bursa gets infected, joint also gets infected. Ligaments. In capsule, there are two thickenings. So let us start with the first two. One thickening is deep to meniscus, that is called as coronary ligament. Coronary ligament. One thickening is deep to the fibular collateral ligament. Fibular collateral ligament is on the lateral side. There is a very short thickening, and that is called as short lateral ligament. Short lateral ligament. Coronary ligament is nothing but a thickening deep to the meniscus. Short lateral ligament is thickening of the capsule deep to the fibular collateral ligament. So with capsule only, first two हो गए. So total 11 ligaments, we have covered 3. One is capsule. Now when you talk about the other two ligaments, you have to draw this diagram. Femur, tibia. Fibula. So this is medial side, that is lateral side. ये डायग्राम जो मैं आपके लिए ड्रॉ कर रहा हूँ ना, आपको याद रखना है कि दी जॉइंट वेरी कॉमन क्वेश्चन, commonly asked question. What do? We have to just draw 3 lines on this side and 3 lines on that side. You have to draw 3 lines on this side and 3 lines on other side. So let's see this side. So first line, this side, will be capsule. First line क्या है? Capsule. Second line and third line are superficial and deep parts of tibial collateral ligament. Tibial collateral ligament. Tibial collateral ligament. Superficial and deep parts of tibial collateral ligament. Capsule, deep part, superficial part of tibial collateral ligament. यहाँ पे सेमी मेम्ब्रेनोसिस होता है बीच में, टिबिया पे इंसर्शन. यहाँ पे inferior genicular vessels होते हैं. Now this side 3 lines. Here on the lateral aspect, the first line will not be capsule because there is an intracapsular origin of popliteus muscle. ये medial side पे adductor tubercle यहाँ पे होता है ना, वहाँ से नीचे tibial collateral ligament comes because it is a divorce tendon of adductor magnus. This side, the first line will be popliteus muscle. First line क्या है? Popliteus, because it is intracapsular. Popliteus muscle is intracapsular. So left side पे first line will not be capsule, but popliteus Second line will be capsule. And third line will be fibular collateral ligament. So second line is capsule, third line is fibular collateral ligament. Is that clear to you? Three lines on both the sides. Fibular collateral ligament. Fibular collateral ligament is attached at the apex of the fibula in between the C-shaped insertion of biceps femoris. Biceps femoris is inserted at the apex of fibula as a C-shaped insertion. ऐसे C-shaped insertion होता है, उसके बीच में fibular collateral ligament is inserted. Clear? Menisci. Now understand here, there is a meniscus on the right side, there is a meniscus on the left side. Okay? The meniscus on the left side is attached to popliteus. Popliteus contracts. Popliteal contracts. And because popliteal contracts, it pulls out the meniscus. It pulls the meniscus out, therefore the right-sided meniscus is more prone for getting crushed than the left side. Because right side is attached to the capsule, while the left meniscus is attached to popliteus, which pulls out the left meniscus. Now the lateral meniscus, this is called as the lateral meniscus, this is called as the medial meniscus. So which meniscus is prone to tear?
Lateral.
Medial meniscus. Because lateral meniscus is pulled out by popliteus. Pulled out by popliteus, prevents its crushing. So tibial collateral ligament has two parts, superficial and deep. Here only in this diagram, you can show a thickening of the capsule deep to the meniscus as coronary ligament. You can show a thickening on the capsule deep to the fibular collateral ligament, that can be called as short lateral ligament. All of you got the concept of coronary ligament is thickening of the capsule deep to meniscus? Yeah. And there are U-shaped ligament and meniscus, medial meniscus and lateral meniscus. Tibia fibula has been taught to you by any chance? Now it will be there today, tibia and fibula. So, demo. If we look at the upper surface of the tibia, if you look at the upper surface of the tibia के upper surface को आप देख रहे हो, ये medial side है, ये lateral side है. There are 6 structures in the interarticular area. मतलब ये कॉन्टैक्ट इधर है. यहाँ पे medial condyle है, यहाँ पे lateral condyle. In between is an area which doesn't directly articulate with the femur. So in this interarticular area, there are 6 structures. Medical college. Latu क्या हो गया? Medical. See, previous when we were studying in MBBS, they used to say Medical College Lahore. लाहौर के लाहौर अपना है ही नहीं, वो कब से नियमन चल रहा है, जब से इंडिया में मेडिकल कॉलेज खुला था. Grand Medical College, which is just 10 minutes away from here, 1845 में चालू हुआ. तभी इंडिया was same. So Medical College Lahore. लाहौर, तो मैंने उसको लातूर कर दिया, लंदन करो। लातूर मेडिकल कॉलेज, मेडिकल कॉलेज लातूर, लातूर मेडिकल कॉलेज। मीडियल मेनिस्कस, anterior cruciate, anterior cruciate, anterior cruciate ligament. Cruciate, there are two ligaments which cross like this. Lateral meniscus, medial meniscus posterior end and posterior cruciate, and posterior cruciate, posterior cruciate. So what are the 6 structures? Anterior to posterior. First is medial end of medial meniscus. ये क्या है? Medial meniscus. ये क्या है? Lateral meniscus. So fast. First is medial end of
medial meniscus.
medial meniscus. Next is
Anterior cruciate.
next is
Lateral meniscus.
anterior end of. Then next is
Posterior end of lateral meniscus.
next is
Posterior end of medial meniscus. Posterior cruciate.
posterior cruciate. Today, don't do dissection of knee joint. You can do of the hip joint. Okay, because knee joint we only have to study many other structures. Now, if this is the tibia, this is the femur, anterior cruciate goes like this, posterior cruciate goes like this. Cruciate ligaments are named as per their origin from tibia. As per their origin from tibia. So this is anterior, this is posterior. फीमर पे ये पोस्टीरियरली अटैच होता है, एंटीरियर क्रूशिएट, और पोस्टीरियर क्रूशिएट फीमर पे एंटीरियरली अटैच होता है, पर उसका ओरिजिन टिबिया से है. एंटीरियर क्रूशिएट gets attached to the medial surface of the lateral meniscus. Medial surface of the lateral condyle, not meniscus, lateral condyle. Okay? So anterior cruciate gets attached to medial surface of the lateral condyle, and posterior cruciate gets attached to lateral surface of medial condyle. Is that clear to all of you? Anterior cruciate becomes taut during extension. Taut means tight. Posterior becomes taut during flexion. Menisci, there are many functions of the menisci. Menisci you have seen, they make the articular surfaces congruent, they spread the synovial fluid evenly, they are proprioceptive due to their rich nerve supply. Football players, meniscal tear. Have you heard meniscal tear? Football players में very common. And then आपने सुना है, आपको हुआ है? किस का हुआ है यहाँ पे मेनिस्कल टियर? हाथों पर एक दो चलो होता है लोगों का. मेनिस्कल टियर इज वेरी कॉमन एंड इट्स देन बेड रेस्ट एंड देन बिल्कुल जगह से हिलेगा नहीं होता. तो कहाँ तक पहुँचे हम लोग? 1 was capsule, 2 was two thickenings of the capsule, 2, 3, 4, 5 was
collateral,
tibial collateral ligament and
fibular collateral ligament,
fibular collateral. 4, 5, 6, 7 was two menisci. 8, 9 was
two cruciate,
two cruciate. Now बचे दो popliteal ligaments. Last two is popliteal ligament. So you on the medial surface here is the insertion of semimembranosus on the tibia. Semimembranosus gets inserted on the medial condyle posterior surface. वहाँ से some fibers go like this, and that is called as oblique popliteal ligament. Oblique popliteal ligament. When have we come across oblique popliteal ligament before? Floor of the popliteal fossa when we studied, right? Floor of the popliteal fossa, superiorly formed by the popliteal of the femur, middle part formed by the capsule of the knee joint with oblique popliteal ligament, and lower part it is by popliteus. Clear? And then there is opening in this, through which an artery goes inside the knee joint to supply the intra-articular structures. What was that artery? Middle genicular artery. Sometimes in the exam they ask, knee joint पूछा तो आप लोग खुश हो जाते हैं 1 + 10. Now you know. Arcuate popliteal are just fibers of another one of the ligament. Very non-specific, but you have to name it. The last one is arcuate popliteal ligament. So in the exam, they may ask knee joint, so you'll be very happy. You know the nerve supply of the knee joint is now the femoral nerve wire now to vastus medialis and posterior division of obturator nerve and tibial nerve also. Blood supply of the knee joint will be by the genicular arteries. So what are genicular arteries? You have heard of descending genicular branch of femoral artery, 7th branch given in the adductor canal. Then popliteal artery gives 5 genicular branches. You remember their name last time I told you. Superior medial genicular, inferior medial genicular, superior lateral genicular, inferior and middle genicular. Exam में ये सब मैं उस exam में suddenly they ask a question, write the intra-articular structures of the knee joint. हम यार knee joint क्यों नहीं पूछ सकते? Intra-articular structures, don't worry. Menisci and cruciate. These are the intra-articular structures. They are there inside the joint. समझ रहे हैं? And there is tendon of popliteus. Tendon of popliteus. Flexion, extension, axis of flexion extension will be transverse. Movements causing flexion at the knee joint. The muscles causing flexion at the knee joint. Hamstrings, hamstrings, gastrocnemius, plantaris. Mainly hamstrings, flexion and extension. Rectus femoris and the 3 vasti. Rectus femoris and 3 vasti. Now rotation, the next moment is rotation of adjunct and conjunct rotation. Two types of rotation are. Adjunct rotation is independent. Conjunct rotation occurs with every flexion and extension. Okay. Adjunct rotation occurs with a flexed knee. In a flexed knee, there is medial rotation and there is lateral rotation. Medial rotation caused about by? Last time we सिखाया मैंने flex semimembranosus, semi. While lateral rotation will be caused in the flexed knee by biceps femoris. अरे यार मैंने ऐसा करके भी आपको दिखाया था ना, नी अगर फ्लेक्स करते हैं तो रोटेशन होता है ना, नी को फ्लेक्स करते हैं, इधर चढ़ के बताऊं, नी फ्लेक्स करते हैं तो रोटेट कर सकते हैं ना, अदरवाइज वी कैन नॉट रोटेट. So that rotation is independent. Well, this happens with every flexion and extension. So there is something called as locking and unlocking of knee joint. Every time we do extension, आपने realize किया रहेगा lateral meniscus is very small. The lateral condyle of tibia is also very small. So suppose this is my right side leg. So the lateral condyle extension में completely use up हो जाता है. और medial condyle के पीछे थोड़ा space रह जाता है. So during the last stage of extension, what happens is the femur rotates medially like this. करके lock हो जाता है. So when I am standing in extension, flexion से when I do extension, in the last stage of extension, the lateral condyles of the tibia is used up and there is a space on the medial condyle. So femur rotates medially and gets locked. So when I am standing like this, both my knees are locked. उसका advantage है कि my now muscles are not strained. My muscles are not strained, my knees get locked. So in standing position, just to extend, नहीं तो हमारे quadriceps कितने रुकेंगे, खड़े रह के. They will have to be continuously in a contracted state. So knee gets locked. I'll explain it to you on bones next time. So unlocking करते समय क्या होता है? Unlocking करते समय there is a slight lateral rotation of the femur and then there is flexion. So when I am extending again, in the final stages there is medial rotation, knee gets locked. So flexion, medial rotation, knee gets locked. Lateral rotation, knee is unlocked, then there is flexion. Extension, what happens in the last stage of extension? Last stage of extension, what happens? Medial rotation of femur or tibia. By that knee gets locked. What happens during flexion? Firstly, lateral rotation of femur or tibia and then flexion. So this action, locking is done by quadriceps femoris. Unlocking में क्या होता है? Knee, femur क्या होता है? Unlocking में lateral. So which muscle is attached to the lateral side here on the femur? Popliteus. So that muscle causes the lateral rotation. So therefore, muscle which unlocks the knee joint is popliteus. Unlocks the knee joint is popliteus. Muscle which locks the knee joint is quadriceps femoris. Applied anatomy, osteoarthritis most common. Osteoarthritis most common in the knee joint. Meniscal tear. Which meniscus is more prone to tear?
Medial.
Medial meniscus, because lateral is pulled by the popliteus. Okay, so I'll stop here. Thank you so much. Next time I would